Hi, I'm Esther.
And I'm Shaun.
I write about AI news here at TechTarget.
And I edit Esther's stories.
We're here to talk to tech experts about everything AI, from open and closed models to AI agents and who's ahead in the generative AI race.
And even the elusive AGI.
We've got it covered, right, Shaun?
Yep, we've got it covered.
Hello, everyone. Welcome to another Targeting AI podcast from Informa TechTarget's AI business. I'm Esther Shittu. My co-host Shaun, Sutner, and I are joined by Madhav, Thattai, SVP and COO of Agentforce Product Management at Salesforce. John Oberg, the founder and CEO of Precina Health, a Salesforce customer, is also here with us. So thank you both for joining us. Madhav has been with Salesforce for about 5 years, first serving as SVP and COO for customer success. Before then, he was at Google, and before then, he was the founding CEO of Rigetti Computing. John Oberg has led Precina Health for the last 4 years. The company has a mission to curb the rise of chronic diseases and simplify healthcare management. Before Precina, John founded the John Oberg Companies, which is focused on improving workforce performance. Thank you for joining us today.
Thank you. Good to be here.
Thanks for having us.
So before we dive into Precina's use of Agentforce, we should note that both of your companies are AI focused now. So the question is for both of you, what does being AI first mean for Salesforce, and what does it mean being AI first for Precina?
Yeah, I think so. For Precina Health, being AI first for us means that we use AI every place we can inside of our medical practice to be able to have the patient and the provider then spend more time together for better patient health outcomes. And so this leads to a number of things for us. It leads to better clinical outcomes and then better financial outcomes, and in very real ways. And so for us, technology is the thing that catalyzes the ability to write an entirely new set of protocols medically, and then also in clinical behavioral health, so that patients can take diseases that in some cases our patients have had for 10, 20, 30 years uncontrolled, and over a period of 10 or 12 weeks, get that disease state into control and even remission with things like type 2 diabetes, where you take people that were very, very sick for a long period of time. And because we have so much more human resource available to talk to the patient because of the way that we use AI, and now we get to start exposing AI to our patients as well, it creates real clinical outcomes that then translate to financial benefits for patients, financial benefits for payers as well.
Yeah, and I think on Salesforce, we have two missions, right? One mission is obviously how are we going to help our customers become AI first and agentic enterprises, and that is really what drives our product strategy. It's what really drives our business goals. But inherent to that is we have to be an AI first company ourselves, and that means how Salesforce uses agentic technology is actually our number one priority. And that's really important because we have to make sure that this technology works at the scale and complexity of a company like Salesforce in order to ensure it is hardened and going to be extremely effective when our customers start to use it. And so we call it Customer Zero or Salesforce on Salesforce. There's going to be a tremendous amount of content about this at Dreamforce this year. And we've really looked at it as what are the key business processes where we think the agents are going to have the most significant impact. The first one we went after was in our support process. So if you go to help.salesforce.com, it looks like no other support website you've ever seen. It doesn't have a landing page with a bunch of content and all that. It is an agent experience from the get-go. We've now done over 1.5 million fully agentic conversations on that website. And that has really, really changed our notion of how do we build these agents at scale and what does it mean to drive efficiency inside the company to really augment all of the tremendous work that our humans do to drive customer success as well. So that's a really important thing. We've been experimenting and really launched a lot of capabilities on the sales side. We think how we market to customers can completely change now. Marketing typically is thought of as kind of a one-way street where you reach out and you hope that somebody responds. But imagine if you could do marketing in a way that is more personalized and can lead to an actual conversation. That's going to create a much richer experience for a customer, and it's going to drive better marketing objectives. In our sales process, Mark Benioff talked about this a couple of weeks ago. Through the history of Salesforce, there's probably tens of millions of people that have reached out to Salesforce interested in our product where we just didn't have enough people to reach back out to them and find out what they were interested in. But with this agentic technology now, we've rolled out agentic sales development reps that could actually start to proactively reach out to these customers. Hey, what are you interested in? How do we think about what you want to go buy? That can then augment the way our humans are then able to really provide solutions that are very effective. So across marketing, across sales, across service, internal in our HR organization, we just went through our typical kind of performance and promotion cycle. About 70% of the administrative tasks that managers had to do were offboarded to an agent. So remarkable amount of productivity that we can drive with these agents. And of course, importantly, Slack is a part of Salesforce, and Slack is where humans orchestrate and do a lot of work. We think these agentic experiences inside Slack are going to be very, very impactful to our customers, and we are no different. We have agents that are helping our sellers build more personalized briefs and recommendations as they are engaging with customers. We have agents that are helping our customer success people make sure, hey, if a customer has an issue, how do we make sure we're solving it? What's the right triage we need to do? And so really across the board, our CIO, Joe Inzarello, and his team have now built, 60, 70 agents that are in production that are really performing some really important tasks for us.
So taking a look at Precina, John, we would like to start by just starting with, like, how did your relationship with Salesforce begin? How did you become introduced to Salesforce? And what problems did you have as a company that you felt like Salesforce could solve for?
It's a great question. So, we started this journey back when, my mother-in-law had a type 2 diabetic event, and I went back to get some research done at USC, and I wanted to solve this problem for people because it seemed like we have all the right medicine, we have all the right devices, like why isn't this working? And so in our first pilot study, we had 50 patients who were very sick. We were able to reverse diabetes in 49 out of those 50 patients within 12 weeks and keep people out of the hospital for the next 2 years. And we built all this technology into a prototype that supported all of that. And then we built a second prototype and a third prototype. And after all of that clinical research, we said, okay, now we need to be ready to scale. And so we went out to the market and we looked at all of the major technology companies and we asked ourselves, should we build this technology ourselves as a medical practice, or should we rely on a platform to help us go to market? Because at the end of the day, we still have to think about things like cybersecurity. We have to think about things like compliance. And what we recognized was that these platform companies were going to spend more on security than we would have in revenue. So it became very obvious to us that using a platform could be a good solution. The question became which platform. And we evaluated everybody that we could find. And Salesforce was the runaway winner. And I think that all of these great innovations you're hearing about from Salesforce today are absolutely every bit as amazing as you're hearing about. But the thing that really got us hooked was the platform that we were able to build upon gave us the ultimate flexibility. We could use all the tooling Salesforce was creating and really dial it into our medical practice. And we could also bring our own technology and plug it in where it didn't make sense for Salesforce to do work in certain areas. Like there are some parts of diabetes management that are so specialized that Salesforce will likely never get into that level of agent, but they've made it so easy for us to bring that technology and do it ourselves so that we don't have to become a technology company. Salesforce is the technology company. We're a medical practice. And so for us, the partnership has been so wonderful because we can be a medical practice. And when they talk about trust being the number one value, like that's a really important thing for us because we've got to rely on that, not just for compliance reasons, but our patients have to know that they can come in, have a conversation with us, with our technology, and know the data is getting to the right place, the providers, back to the patients, being created in a way that's not hallucinating when we do things like meal planning and recipe planning. And they have ultimate confidence that it's moving their health journey forward in ways that aren't just, clinically measurable, but feel great for the patient day to day. And the way that plays out is really simple. Before, when a patient was told to eat better and exercise, they didn't get it done. Today, when we talk to our patients about eating better and exercise, we're able to spend the time and energy to actually create a meal plan in minutes and then develop that into recipes that are for exactly their family size, for exactly the size of meal they want to make. And then we give them a shopping list based on what's in their pantry today. Like it's this nitty gritty that the power of Salesforce allows us to give to these patients in just minutes, where in some cases, patients aren't able to get that at all from some medical practices. And we can do it right then and there with the provider. So we're really excited about not only what's happening and what's being released today, but I think the future holds even more promise.
Okay, John, You've spoken in the past, obviously, about using Salesforce, Agentforce to improve the way you approach diabetes care. So Agentforce played a key role in automating a lot of the routine tasks to it formally made the process of helping patients with diabetes cumbersome. So why did Precina decide to take an agent approach instead of relying on the old predictive AI technology or just generative AI itself, like smart chatbots. So like in the case of your case study on the Salesforce website, you mentioned you were able to save $80,000 per 5,000 patients. Can you elaborate on that, on those savings, and like what is it in aggregate? I don't know if you can say how many patients you have, but please talk. I know it's like a four-part question, but sorry about
Yeah.
that.
I'll answer as many parts as I can. Sure, yeah. So I think the first thing Salesforce talks about agentic companies, and they've done a really wonderful job of integrating all of the agentic parts of it. And I think a lot of people think about generative AI when they think about agentic workflows, but that's just not the case. It allows you to take generative AI, use that next to predictive AI, but then also use that to kind of all of the technologies that for the last several decades have given us the promise of automation. And for a small company, it's taken the promise of automation and made it real. And so when we think about automation at Precina, we don't just think about generative AI. We think about all the predictive AI that we've been using for a decade. We think about all of the generative AI that's new and hot and the thing everyone's talking about. But there's also just like expert systems that need to be asked questions to make sure that things are done properly. And Salesforce has put those on a buffet that's so easy for us to come and say, okay, here's the way we can put this together. And for a small company with little technology budget, it's affordable. And it makes it better for us to not only make it affordable, but to deploy it very quickly. And that gives confidence to our team that is not technical. Like, okay, when we have a problem, we can find a technical solution. And it's not the problem of the past where I have a friend who's worked in healthcare for years, and their take used to be, oh yeah, technology promises it, then I clean it up later. And that's not the story anymore. The story is technology promises it, and now we can actually make it real because we can take whatever pieces make the most sense, put them together into the right workflow. It happens to be agentic, and then it actually works. And so let me tell you how that plays out in our company to save money. When we have something we have to train a provider on, in one real example, our providers need to learn how to be hyper empathetic for a patient's circumstance. So when they're planning with a patient, their medical plan, that the patient's circumstances are heavily weighted into that planning session. That takes time, it takes energy, it takes being able to ask the right questions. And that's a new skill set for many providers. So we'll come in and we'll train those providers, and then we let them practice with an agent who never tires, who gives them real-time feedback, and then tells the manager what things that person may need to work on with a human so that we can continue to improve their skill set clinically. And there's no shame or guilt or worry from the provider that, oh, I messed up or made a mistake, because the agent has no judgment and never gets tired. That's a real process happening in our product, in our platform today.
Just a quick follow, because you mentioned obviously, Dr. John, that you are not a technology company, you are a healthcare company, and I wonder for Madhav, for you, is that the goal for kind of that collaborative process where you guys bring the technology and then also your customers kind of do what they do and kind of offload to you, or is it more like, or do you seek more of like a collaborative process?
Yeah, look, we're deep in the trenches with our customers as they're building out these enterprises, right? It is collaborative from the get-go. We need to deeply understand what Dr. Oberg's company is trying to achieve. What is their goal? What is their KPI that they're trying to unlock? What's the experience they need to build? And that is context that only they can provide. And he touched on a couple of things that I think are really important, and I think go back to some of the questions you asked earlier. The generative technology is one component of a fully autonomous system. The autonomous system requires data. It requires business process and logic and execution. It requires context, as we talked about. It requires integration between systems. No one system is going to complete every single task. We fully expect we're going to live in a world where the technology integrates at different layers. Maybe even agents, are integrating and orchestrating at different layers. And that is the direction that this is going to go. What we have to do for customers like Precina is ensure that they have all the connectivity and the tools sitting on this platform of trust that they and their customers can rely on. And that means giving them the ability to build these agents, giving them the ability to integrate their own predictive models and machine learning where necessary, give them the ability to execute tasks, not just in Salesforce, but to be able to hand off things to other systems or bring in information from other systems. And so that architecture we have built with this kind of openness and connectivity in mind to make sure that our customers have the options for how they want to architect things. And as Dr. Oberg said, there's some things in your business process that are going to be very Salesforce centric. Your customer interactions, how you think about that flow. Salesforce is going to be your kind of system of orchestration of these kinds of tasks. And as you bring the agents in, those agents are going to play a really important role. But there's other things in Precina's business that are not Salesforce centric. We still want to make sure Salesforce can connect to those systems so that the relevant information is passing, the relevant tasks are being executed. And so this openness and this interconnectivity, I think, is really, really important. So we want to make sure that we are setting up our customers with that and working with them closely to say, okay, this is your goal. This is how the architecture works. Now let's make sure we are connecting these things in the right way so things are flowing in the most efficient and the most accurate and in a trusted way. The additional thing that we want to do is to give people like Precina and Dr. Oberg's team a set of tools to manage all this capability. Right now, we're talking about the execution and the experience of the agent itself. But remember, there's an entire class of people that are going to be agent managers in the future. I'm sure there'll be people at Precina whose jobs it is to make sure that, hey, are the agents doing the right things? Are things connecting the right way? Are we executing on this process the right way? And so Salesforce also has a long history of management tools, governance tools, analytics, observability. How do I improve these things? And so that's been a really big investment that we've made in these agents, because I will say it's not a fire and forget type of application. This is a thing that's going to improve over time. You're going to add more business process. You're going to learn things that say, hey, this was the wrong data. This is not the right way we should tune the agent. This is what we need to connect. And so we really want to make sure we're giving people that set of tools so they can flexibly perform all of this different business process. But I think Dr. Oberg said it really well. We should not think of agentic systems as just purely the generative component. These are autonomous systems that connect your entire enterprise and really connect across your architecture to execute and drive the outcomes that they care about.
I find that interesting, and I want to go back to Dr. Oberg for 1 second, because when we're talking about your patients, right? And this question really comes from, like, yes, we have the technology people as well as the healthcare providers working behind the scenes and working together. But for the patients really themselves, I had this problem this morning where it's like, I wanted to just talk to a real human. I don't want to talk to an automated system. So how do your patients respond to receiving care recommendations from AI agents versus human clinicians or standard automated messages? And then what safeguards you? How do you make sure that you're assuring your agents that there's that personal touch?
It's a great question. And I think it's important to know, we don't use AI to do the medicine. We have a human in the loop. And we have expert systems that are sure and ensure that we have a zero hallucination environment when patients are asking about specific topics. And in some cases, that means the AI can be helpful. In some cases, it means the AI has to point back to the provider, right? And so, in a perfect situation, somebody has exactly the information they want right at their fingertips. So an AI first application. And then if they want to talk to a provider, the AI also has the schedule for the provider and can say, hey, look, if you want to schedule an appointment, we have appointments available today or tomorrow. More importantly, our provider has 5 minutes in between their appointments. If you just need a quick phone call, let us know. We'll have them give you a quick ring. And so we try to be incredibly high touch, but that means the AI has to understand not just the medical chart of the patient who they're talking to, and not just be able to empathize for what the real issue is, but also has to understand the schedule of the provider, how that schedule works out, and how to get a real kind of formal appointment on the books if necessary, or just have them get a quick call back. And there have been times that we've had even one of our nurses call in place of the provider because it's like, oh, I just have a quick question. Let me just get a clinician on the phone or a nurse to help out. And so it's really about how we meet the patient where they are. So AI is the catalyst for our entire organization being aimed at that patient experience, if that makes sense. So it's not about the AI. The AI is just the catalyst.
Okay, thanks. I have a couple of questions. One quick one for Madhav. I'm just curious how Health Cloud plays into Salesforce relationship with healthcare providers. Does it have anything to do with this? And also for John, like how do you balance AI automation with the need for human clinical judgment? So which high impact interventions do the clinicians focus on the most now that many routine tasks are automated?
Yeah, I'll go quickly on the health cloud front. Absolutely. That is a significant part of our offerings that we provide to companies in healthcare. What Health Cloud provides is an incredibly quick, efficient, and highly structured way for healthcare companies to use data that is going to be really relevant to them, use the underlying data model that they can use to kind of guide and navigate how they're constructing their businesses, and all of the business logic and process that we know after years and years of working with healthcare companies are going to really be important for them. So these out of the box pre-built applications are really a jumpstart for customers to be able to structure their businesses and make sure that they are executing in the right way from the get-go. And that's really where our applications play a significant role. And there's a lot of AI built into these applications. There's predictive AI that's built into these applications. There's generative things that are very quick and easy to use for users of the applications to use. And of course, there's agents themselves that are pre-built, templatized, that already have what we believe are applicable skills for a number of healthcare organizations to use completely out of the box. So we really want to make sure, and Dr. Oberg said this, and we believe the same thing, we want to meet customers where they are. If a customer says, hey, an application like Health Cloud has all these incredible capabilities straight out of the box, I can get going quickly, I can start executing on my process, fantastic, I'm going to go use that, let's go do that. If you have a more complex business process that requires a little bit more kind of stitching some things together, we want to make that super easy as well with more of our platform capabilities. And so we always take this approach, even before agentic technology, we already had this approach at Salesforce, which is we want to get customers as much of a running start as possible with our applications, but we really want to unlock and provide highly flexible platform tools so they can make it their own. They can really translate that to the things that apply in their environment.
I'll just pile on because we did a lot of diligence. Once we selected Salesforce, part of our diligence was whether or not we needed Health Cloud. And so we asked a lot of questions about, can we do this just using Sales Cloud, Service Cloud, Marketing Cloud, other ways of putting things together. And in those questions, it became so obvious to us that Health Cloud was the runaway answer, not just from a cost perspective, but from an ease of use perspective, and not just from building a perspective, but ease of use long-term. And then we actually got under the hood to see some of the data models and the objects they put together that are kind of Health Cloud standard objects, but not standard in other clouds. And the thoughtfulness that's been put into it was astounding, like just absolutely amazing how much work has been done before we got there. And that's going back 2 or 3 years. And there's more work being released all the time. So just to pile on, that like Health Cloud's been super impressive from our perspective. And then I forgot the second question, Shaun, that you asked.
Oh, about the clinicians. What are the most high impact interventions do clinicians focus on?
Yeah, I mean, our clinicians are involved in every medical decision, so we don't outsource any of that to an AI. Now, our AI does things like provides guardrails for clinicians, and so it might say things like, "Hey, we've looked at all of your decisions. By the way, have you considered this other thing that's highly likely or highly unlikely?" And so we have AI that we're trying to train to figure out where we can get it to lower the cognitive burden for our physicians, but we don't believe it takes the place of a physician at all. We think it's entirely supportive. And so, one way would be just when you see, plaque buildup in the vascular, and again, I'm a behavioral health guy, not a physician. So, but when our physicians look at the vascular plaque and the things that are happening, that can show up in your arteries in one way, but it can show up in your organs in a different way. And sometimes it's not totally obvious what's happening. But when you look at all of the labs over someone's, last 10 years of their chart, it may not be useful to have a human do that, but it may be useful for the AI to say, okay, here's one chart, that maybe you didn't take a peek at. Let us go ahead and just stack rank the charts in terms of what may be most important to review that may not seem obvious. And so we have those systems in place today, which has been great because it helps our providers have confidence that, we may have, in one case, we have 20 years of charts for a patient because people sent us everything. We don't need to look at all of that. It's not useful data for the most part, but we can't have an AI go through all of it and say, is there something I'm missing? And that's been, given us a lot of confidence that we're at least using all that information appropriately.
So we're talking about healthcare, obviously. So I was wondering, in what other ways do you envision like agentic AI playing a role in the healthcare world and for healthcare professionals?
Yeah, sure. I have really high hopes. Like, there's a couple of really big problems in the world that we're seeing. There's not enough mental healthcare workers in the world, and you have a retiring population that's being marginalized and kind of seen to not add value to society by some people, which I think is a horrible, miscarriage of the way that we view the wisdom in the world. I would love to see a world where we engage people in non-therapeutic conversations, but mental health related, where we can have AIs that both give us the cost effectiveness to train those people as peer counselors, and then also are able to listen into those conversations for therapeutic markers. So when a therapist is indicated, a therapist is then called so that you don't have that clinical danger of someone going into a conversation that could do damage. And you can bring all of this wisdom kind of back into the world in a place where we need more mental health workers, but not have the same, master's degree with 3,000 hours of clinical oversight required to get somebody there. Just use this concept of peer counseling, which has been used in the world for the last 40 years. I think AI can play a massive, massive role in helping us move that forward. It's super cost effective ways. I've not done any, research on this yet, but my back of the napkin math says we can lower the cost of some parts of mental health care by like 95%. And it doesn't mean that therapists are going to be any less valuable. We still need more therapists, but we could sure use more peer counselors doing things that support therapists in helping our world to be kind of more mentally healthy. That's one kind of wild idea that I have that we haven't started on yet, but I think we're going to see those types of innovations in the coming months and years.
It's a profound point about, I think, our view of AI as well at Salesforce, which is we believe that these are human plus AI systems at the end of the day that are going to deliver these experiences. But you touched on a couple of things that I think are really important. Today, when we think of these AI agents, we're only thinking of them in the context of someone talking to customer support, or, there's some part of a process, or there's like, we're giving assistance as to personal, as a personal assistant, I'm using ChatGPT, those kinds of things. But what you touched on is a pretty important point, which is a lot of the work that these agents are going to unlock is things that the humans don't have time to get to today. If I can do processing for 95% of my patients in the background to set up my actual healthcare professional in a way that they can execute more effectively, that expands the coverage that we can possibly offer our patients and the kinds of things that we can do. So one, AI in the background, we believe is going to be really, really important. One of the most profound and probably most impactful uses of it is going to be in that operating mode where it is executing at scale on things that we've just not been able to do in the past because we simply didn't have the coverage to do it. So that's one really important thing. And the second important thing that you touched on, which I think is really important, is because we have this technology, we can now greenlight projects that we couldn't greenlight before. Things that might have not been economically viable. Hey, we didn't have a way in which we were going to be productive enough to go deliver on this. It's a really good objective, but the math just doesn't quite work. If the agents are able to bend the productivity curve and the efficiency curve, it means new experiences can now be offered that we would never have thought of before. And I love your example of mental health. Like I'm sure companies that have gone down this path before have had to make the very difficult decision that it's just not an area that they know how to go provide more expertise for in an effective manner. But if this technology is able to augment those, and now the bar for what we say yes to starts to drop, it means that there's going to be a lot more innovation and greater experiences that are going to be put in front of customers. And I think the impact in your industry particularly could be significant.
What makes trust so important, right? Because if I'm going to ask an AI to listen in for a clinical indication, I have to believe the system is going to be trustworthy in how it treats that data. And there's a whole lot of ethical questions around what I've discussed today that would have to be unpacked. And I recognize the kind of the radical thinking involved, but I think we need to think about things in this radical way to take problems that used to be considered intractable and make them tractable.
Absolutely right.
Okay, so I had a question mainly for John. In what, if any, ways did Agentforce prove challenging to implement, or what improvements did you need to make with Agentforce to get the result that you wanted or needed? There must have been some degree of experimentation involved.
Yeah, I think when you're on the kind of bleeding edge of any technology, there are going to be challenges. And our company was the first customer company anywhere in the world after Salesforce to deploy 2 specific agents. And so we did find that there were some deployment problems. And so there were some permission set problems, and there were some, there were some things that were candidly, we were, again, the first company in the world to deploy these 2 particular agents. We expected that going in. So we knew we were going to have to walk over those hurdles, and we asked for that, for that role. The great news is that Salesforce wanted feedback, and they continually fixed these problems as we found them. I think with any kind of innovative or early adoption company, you have to know where you're going to see some friction, and you just have to build that into the budgeted time, energy to get through that friction and not be frustrated by it. And I think that there are some people who are kind of more set up to be kind of late adopters, and then in the adoption curve, and that's okay too. I would say that our company has been built to be more innovative and on the early adoption side of things. So I think there's a couple things. I think Salesforce is incredible in that it can do almost anything from our company's perspective. The challenge is that Salesforce is incredible and can do almost anything. And that means that it's such a vast amount of information to take in that you have to have a little bit of guidance about what information to take in and how to do that better. I think there's been some really great efforts very recently to help people get through Trailhead, to help people get answers better. And I think using generative AI, even by itself, to ask for the starting point to get to know Salesforce better for all levels of users. So not just for developers and administrators, but even for just people that want to become power users, I think is really, really helpful. I think, they're moving so fast that inside Trailhead, some things haven't been working perfectly the first time. And so if you're trying to be on the very, the first users of things, we just expect there's going to be some problems. And we had to give some feedback like, hey, we don't think this thing is working the way it should be in Trailhead. And they've gone back and they've had to fix it. So yes, Salesforce is releasing very quickly. Yes, they're releasing what I would call hardened products, post beta, but there are still bugs that are going to have to be worked out. And so I think people have to be just open to the fact that you only want to use these types of workflows in places where you can have the amount of friction without putting anybody in danger, your business, your patients, and we're just really thoughtful about that. So we practice in what I would call very low consequence environments, and we deploy data and technology into high consequence environments much more rigorously. But we have confidence when we do it with Salesforce that we're going to do it correctly, and we feel good about that.
Yeah, I mean, I'll give you a way that I think we've seen this, Shaun, with customers like Precina and others. It's kind of day 0, day 1, and day 2 problems. The day 0 problem is, can I trust this thing? How do I know that I can trust it? What is it doing with my data? Where's the privacy, et cetera? So you have to make sure that we're really focused on that. And we've done a lot with our customers to make sure that we're improving and hardening the trust part of the question. That's number 1. Day 1 problems are, what data do I bring in? How do I connect that data? If I don't get that right, I'm not going to make a very useful agent. I'm not going to make it very accurate. So we work with customers like Precina on, okay, what are the things that we have to make easier for you to bring that in and bring the relevant data in? So the data is really important. The second thing we talked about, which is one of our really important Dreamforce releases, is this whole idea of agentic control. If I have to execute a really long process, complicated, structured process, the LLMs are not capable of handling that themselves. So we have to bring in some ability for deterministic logic to sit alongside all of the LLM goodness. And so that really was one of the most important signals for us that's driven all this innovation we're talking about. So the control, the context, the experience, what does the experience look like? How do I make sure it's relevant, it's rich, et cetera? Those are kind of the day 1 problems. And then the day 2 problems, customers like Precina and people that are a little further along the maturity curve, they start to ask us questions about, how do I monitor these agents? How do I make them better? Where do I get analytics on where's the agent performing well and where isn't it? So I can go tune and tweak the things that are important. I need to understand, is this driving my KPIs? Is this driving my ROI? And so as you see people really go along that maturity curve, starts with trust. Then it's, how do I build a good agent? And then it's, how do I manage these agents and make them better? That's kind of how we see people along that curve. And it's a very rapid iteration that we're doing with customers like Precina that are kind of at the cutting edge of this.
Okay, thanks. One of the biggest things our audience for AI business enterprises cares about is ROI. So how does Salesforce help customers achieve ROI? And for Precina, in what ways are you able to say that you've achieved ROI in your deployment of AI agents so far?
Yeah, I think for us it's really simple. So we do a lot of time and motion studies, and so we can find out what the time and motion is both pre and post deployment of technology. And then for us, we're again, we're a smaller company, so we're constantly thinking about, does this drive real top line dollars in the bank, or does it drive real hard expense out of the business? And so I think there are a lot of soft expenses and soft revenue gains that people will be able to measure using sophisticated, financial metrics. Again, we're smaller than that. So I want to know hard, numbers. Did this drive revenue or did this drive expense out of the bank? And the other place that we measure is, what does this allow us to do that we wouldn't have otherwise been able to do? And so I think I've already given the example of like having a role-playing coach for skill development. Like that's a level of skill development that very few companies have. And as a smaller company, we've already deployed that and have that in-house today. And that's probably one of the easiest examples to understand inside of a medical practice for us.
Yeah, I mean, for us, a very important signal for us is when we work with a customer who has a clear KPI that they're going after. Most of the agent projects that I've seen that are kind of AI for the sake of AI don't really go anywhere. And so when it is a specific goal and a specific KPI, it tends to be a much more effective outcome. So that's something we do upfront with the customers as we're talking to them. And then we want to make sure we're giving them tools to measure these things. Customers have obviously measured ROI and KPIs and important business metrics on Salesforce for a very long time, but we want to give them the analytics and the tooling to say, hey, let's tie agent performance to these KPIs that you really care about, so we can have a direct line on, are we driving impact on that? If it's a productivity goal, great. If it's a growth revenue goal of some kind, great. Let's make sure we're tying the agent action and the agent improvement to what that KPI actually is. And that's a really important part of what we think of as kind of our management suite for people like Dr. Oberg and people in his organization that are really looking at this holistically for, okay, are these use cases driving value or not?
Thank you.
Perfect. Thank you. You were really good. You were really great. So thank you for your time, Madhav. Thank you for your time, Dr. Oberg. Thank you to our audience and to our listeners. To our audience, please feel free to share, to like, to subscribe on the YouTube. Also, please feel free to go to aibusiness.com, where you can read more about Salesforce news, read more of some of the Dreamforce news that came out yesterday and more that's coming out today. And please check out Precina as well. And you can link up with both of these men on LinkedIn. Thank you again, and we will see you next time on Targeting AI.
To hear the full audio podcast, please go to Apple Podcasts, Spotify, Amazon, Audible, TuneIn, Podbean, and other popular podcast platforms.